So this is my first ever video driving in my car. I see lots of people do it, but I'm just doing a tour of the University of Calgary Medical Center and the brand new cancer clinic that they're building here in Calgary, which is a multi-million-dollar amazing facility. And then the Alberta Children's Hospital, which I just toured, which I don't even know how many square yards or meters it is, but it's absolutely a monster. But in Canada, people complain sometimes, well, a lot of times, about the healthcare system. I saw a video on YouTube a couple of days ago that just simply angered me, where somebody was complaining about healthcare in Canada. Is it a problem? It's not perfect, but considering it's free and we're not paying hundreds of dollars a month in insurance, and it's an amazing system. I've heard so many people in the US say, yeah, it's free in Canada, but it's not very good, and you have to wait a long time for things. You know what? You have to wait for some things, yeah. If it's not urgent, you're going to wait. But I can tell you that I had a heart attack. I was in the hospital for 6 days. The service was absolutely amazing. No question, they saved my life. My father had cancer twice. He went through that and is still alive. He survived it. My mother had cancer. She was at this Tom Baker Cancer Center. Unfortunately, they caught it so late, she didn't survive it. But my son, Scott, was born at this Foothills Hospital. He was 7 weeks premature. It was unbelievable how amazing the service was. And again, it actually makes me angry when I hear people complain about healthcare. When my son was born, he was 7 weeks early. He was about 4 pounds. He had a really hard time breathing. He actually was completely purple at one point. He'd been born a cesarean. My wife had something back in the day that was dangerous called HELP syndrome, HELP. She almost died. They had to do an emergency cesarean. That went extremely well. And then he was in the hospital for several weeks in neonatal intensive care in that ward, which is amazing. And now we're talking back in 1992 or 1990, somewhere in there. And they have the neonatal intensive care unit, one nurse per baby, 24 hours a day. So there's always one nurse standing right beside your baby. Now, in our case, we were fortunate. He was actually 4 pounds, which isn't too bad. But there were babies in there that were a pound, and I'm looking at them and they don't even sound like babies when they're crying. I can't even describe what that's like. But one nurse per baby. So you go in, there's always a nurse standing beside your one baby, and when that nurse has to go on break or has to go to the washroom or something like that, another nurse comes. 24 hours a day, one nurse per baby. How many places in the world can provide that? It's absolutely amazing. I had a major car accident in the US. I was in the the University Medical Center Hospital in Las Vegas, and it was okay. This was 2004. But seriously, and I'm not trying to brag, but I couldn't wait to get back to Canada, because the healthcare system here, for the most part, is far superior, I should say, to a lot of the places in the US, and of course other countries as well. My other son, born in that hospital, things went well. My daughter, born in that hospital, things went well. There's so many instances that I can think of. I had a heart attack. I was taken care of incredibly well. I was in the hospital for 6 days there. I had shoulder replacement surgery at a hospital. It went incredibly well. When I got airlifted back from Vegas to Calgary to the Foothills Hospital, the care was amazing. I was there for 3.5 weeks. I can't even really explain how amazing that hospital was for me. And now I've got 3 grandkids, all born in the Canadian healthcare system. You don't get a bill, which is amazing. The service, the care was amazing. The nurses, for the most part, I mean, there's some miserable people everywhere, but the nurses were unbelievable. I honestly can't say enough about the healthcare system. So if you've heard that our healthcare system is terrible, that's not true at all. We have some of the most advanced hospitals, some of the most advanced doctors. And it sounds like I'm bragging, and partly yes, because I love my country. But at the same time, I wanted to clear up some of the misconceptions that a lot of people have, that you wait for long periods of time. I had people say, oh, you can die waiting. No. You know, if you're going to get knee replacement surgery, that'll take some time, most likely. Of course, COVID slowed down a lot of that stuff as well. But yeah, is it perfect? No, but I'd rank it on a scale of 1 to 10, a solid 9. I'm just not even thinking of all the incredible healthcare system experiences that I've had in this country. I visited my kids when they had their kids, my grandkids, and I walk into hospitals. They're clean, they're modern, they're bright, great staff, great equipment, and people say, how does it get paid for? Well, honestly, because I worked in the U.S. for 15 years and I love the U.S. and I've experienced healthcare there. Like I said, I was in the University Medical Center Hospital in Las Vegas for 2.5 weeks. It was okay, but I assure you, it was not anywhere near advanced. I'm not talking about every hospital. I'm not making general terms about every hospital in Canada and every hospital in the U.S. But what I am saying is that the experience that I had in University Medical Center was maybe a 4 or 5 out of 10. Now, they saved my life. I'm not complaining. I would never have survived if they had not taken me to the hospital right away. But when I came back to Canada, I was relieved, because I won't even get into the details. But one thing they don't do here is billing, right? You don't get a bill. And I found in the hospital in the US, I was in another hospital in another accident. I got hit by a vehicle, and they walk around with laptops on their hands, and not the nurses, but other people, and they're doing billing. You get billed for everything. When I was in the University Medical Center, they sent me a bill. It came in the mail. I thought it was actually a catalog, and it was a bill about that thick. It was $172,000 Canadian. I won't get into the insurance issue. I thought I was insured, and what they say with insurance sometimes is what the large print giveth, the small print taketh away, or what the large print giveth, the asterisk taketh away. I won't get into the details, maybe in another video, but the healthcare system, for the most part in Canada, is paid by what we in Canada would call sin tax, like SIN, not our social insurance number, but sin tax. If you buy cigarettes in Canada, you are going to pay upwards of $20 a package. I quit smoking in 1983. I think cigarettes were $1 a pack back in those days, but it's over $20 for one package of 25, I believe it is. I see people buying cartons of them, and I think, wow, how do you spend $200 on a carton of cigarettes? And alcohol is incredibly expensive here compared to Canada. I have an immigrant that's staying at my house right now from Mexico. He's been here 2 months, and his comment was, wow, things are more expensive for alcohol. He was stunned how much beer is compared to how much it is in Mexico. But when you think about all the tax that's on cigarettes, other types of tobacco, of course now we have weed, marijuana is legal in Canada, lots of tax on that as well. And I think it makes perfect sense to charge more for things that, and I'm not talking about weed, I'm not opposed to it at all, but of course tobacco and alcohol can cause massive amounts of issues. They do cause massive amounts of issues, and the hospital costs skyrocket just because of heart disease and obesity, etc. And so bottom line is, the US, they've been talking about this healthcare system. I remember the first election I ever watched years ago, they talked about improving healthcare, and then I'm not going to get political, but the whole thing with Bill Clinton and Hillary Clinton was working on the healthcare system. I'm not going to say almost every single politician, when they run for office, talks about fixing the healthcare system. In the US, sadly, they've never fixed the healthcare system, and I'm not saying it's not good. The US has some amazing hospitals, some amazing doctors, some amazing equipment. The research that the US did for COVID vaccinations, absolutely incredible. What bothers me is the cost that people have to pay. I know people who pay several $100s a month for healthcare. Now, I want to make something clear. Healthcare in Canada is hospitals, your doctor, those kinds of things. Healthcare in Canada does not cover dental, although our government just passed a bill. They're going to start to provide dental care for seniors. I'm not sure when that'll start. And just 2 months ago, here in 2022, they just implemented a program for $600 per family per year for children's dental. So dental is now covered in all of Canada. It's a federal program, but prescriptions are not covered by that. Eye doctors are not covered. Well, eye doctors are if you've got like an infection. I had one and that was free. But when you get your eyes tested, when you buy glasses. So healthcare is free, yes, but it doesn't include everything. So for a lot of people without kids and that are not seniors, dental is not included. Pharmacy is not included. But if you're low income, they have programs to provide prescription medications at a very low cost, or in some cases free. So it's a separate program, but the actual healthcare system in Canada, which by the way is not controlled by the federal government, it is controlled by each individual province. So healthcare is controlled by the province, which I like. I like the fact that it's controlled by each province individually, because it's a smaller amount for them to focus on, you know what I mean? If they're looking at, 63 million people across the country, something like that, one healthcare system would be complicated, but it's broken down by each province. But bottom line is, our healthcare system is not perfect. Yes, there are things that you have to wait for, but if it's an emergency, if you need an ambulance, it will most likely be there within minutes, depending on where you are. Of course, you're in the country, it'll take longer, but in the city, I've had some ambulances that I've had to take, and my kids and stuff, and they're usually there. First responders are usually there within a couple of minutes. That would be the police, police maybe, fire department gets there usually pretty quick, some cases volunteer firefighters in smaller places, but you call an ambulance, it's going to be there usually very quickly. It's not always the case. I know a situation where it got messed up. But our healthcare system, for the most part, if you've got an emergency, you have a heart attack, you're going to get taken care of. You have an accident, you are going to get amazing care right away, and you don't get a bill. So for those of you that have heard that the healthcare system in Canada is horrible, that it's really bad because it's free, that you have to wait long periods of time. Long periods of time, yeah, they're referring to non-emergent things. Like I know people have waited a couple of years for hip replacement surgery. But if it's an emergency, our healthcare system is going to take care of you. And I honestly can't say enough about the healthcare system in Canada from my experience with my father, with my mother, with my kids being born, with my health issues. I would rank Canada's healthcare system on a scale of 1 to 10 as at least a 9. So just wanted to clarify, but I'm driving in minus 28 degrees temperature Celsius, so almost minus 40 Fahrenheit. So yeah, it's not great in Canada. And yeah, it's a lot of snow right now. That's the downside, but healthcare, amazing. Till the next time, see ya.